Sophie, back into it. Sophie, just saying back in. Just saying, Sophie, we're back into it. Yeah, that's cool. And Lawrence, getting close to the table there. Watch for the obstacles. Oh, we are live streaming. Sorry, just get serious about this. Radio, thank you very much. That was obviously a very invigorating break. So moving on to the next item. Now, look, I've got to, my apologies, making some calls here. We have to streamline this a little bit because we are running out of time. This next update, strengthening the Older Persons Council, Youth Council and Disability Advisory Group. I've just asked for the presentation to be skimmed through, just so that we, and then I'm going to bring this presentation back at the next meeting. So I just think there's going to be a little bit, some questioning here and some little bit of, I won't say feeling out, but a little bit of getting more of an understanding of what's going on. Also, I note we'll be halfway through, there's a 6-month deliverable with regards to this piece of work, and we'll sort of be halfway through at that point, so it'll be a little bit of an update as well as talking to it when we come back in February, more than likely. With that proviso, I'll leave it to you, Emma, to blast through this.
Kia ora koutou. Okay, blasting through. So I'm just going to do a real light touch around this just to give you a bit of an idea of what we're doing, because I know some people know that we're doing some work to strengthen the advisory groups under connected communities. So this is focused on the Disability Advisory Group, the Youth Council and the Older Persons Council. It sits under a wider review, which Council was doing, which is focused on consistency and accountability across all of the different ranges of advisory groups that Council has. We'll feed into that, and that feeds into what we are doing. So basically we're talking about the 3 community representative advisory groups, not issues-based advisory groups or project advisory groups and other things that Council has had at different times and also has at the moment. These have different roles, and it's really about the 3 that have the demographic representation through those 3 groups. So community-based advisory groups, their focus is, or their expertise is what they bring from the community and how they connect back into community. They're not technical experts, they're not sector representatives. We connect with the sector through the advisory groups for advice and knowledge, but they're not represented in the actual advisory groups themselves. The advisory groups focus on providing feedback and ideas from their communities, and they act as a conduit between the communities that they represent in Council. They do also quite a bit of work around advocating for their communities more broadly. This focus isn't changing. We're strengthening the way that it happens. So very quickly, the Older Persons Council, the voice for older people in our community, has been around since 2008, so it's long term in our community. And in the past, they've advocated to government organisations, they've undertaken projects to support older people's wellbeing. The Youth Council, I've been around a long time as well, set up probably around 2000, hard to know actually, but again, long term in our community. Focused on young people aged 12 to 24. Very similar, just different demographic. The Disability Advisory Group is focused on supporting, providing advice to Council in a wide range of things, focused on access, equity and inclusion. And I just wanted to also note that we have the 2 chairs of we've got the OPC chair here, and we also have Joanne, who's the chair of the Disability Advisory Group. We don't have the Youth Council representation here today. They also operate a little differently, and it's also the first day of exams today, so not a great day to come to a Council meeting. The spectrum of public participation, you've probably come across that before. It's used widely across local government and central government in terms of the way that we operate with an engagement. These 3 advisory groups sit right across the entire spectrum. We inform them, we keep them informed about things, they pass things on to their communities, we consult right through to empower in terms of supporting them to make decisions and to hold projects as well. This project, the scope of the work is across all of these things. So it's about strengthening it. Like I said, it's not about throwing things out or doing significant changes. It's about tweaking things that we have a better and more effective youth advisory group system. So we get better decisions overall coming through, better advice, and also that it strengthens the community capacity within those groups as well. We're working within a best practice model. So the idea of this is that we strengthen the advisory groups going forward using this best practice kind of benchmark overall. A big chunk of it is around providing good advice and process. This is about how we support the advisor groups. How do we do our role to make sure that they have the information they need to be able to provide recommendations and to decide what they're doing. In terms of what makes good engagement, again, this links into the best practice idea, but this is about what we're looking at in terms of how we deliver this project to strengthen the advisor group. So we're engaging early in how we do this work with the advisor groups, and that we're engaging throughout the process with them. So all of those things in terms of how we're doing this project, but also all of these relate to how we as council interact with our advisory groups ongoing. So it's part of what we're looking at and how we can do this better with our advisory groups. Now, actions at the moment is we've done some co-design work with the chairs. We're working alongside Joanne and Kevin, particularly with this project. The Youth Council themselves has a slightly different, unique, tailored way of working with them because they are young people and their process is a little bit different. So making sure that it's good youth engagement in the way that we're doing with them. We've got times and we've run a whole lot of different sessions with individual members of the advisory groups, and those continuing to happen at the moment. We've run workshops, and I think Kevin was going to have a bit of a comment around the workshop with his advisory group, with the OPC. We're also talking with elected members who are appointed to those groups and a wide range of other people, because this isn't just about how you structure the advisory group, it's about how council interacts with that advisory group. So talking to staff, what do they need, how's it worked for them, how can we make that work better? And then by April next year, we'll have completed that work and we'll be looking at the changes being implemented from that stage. That's me.
Excellent. Thank you very much for that streamlined report. My apologies, I'm not going to take questions with regards to this. I will make one comment though. Part of what I want to see happen is the capture of recommendations that come out of the groups as well, and making sure that there's a follow-up process that this group, this committee was able to report back or follow up on as well. I think that's an important part of these processes, which seems to be missing a little bit. We're aware of it. What I'm going to do with this report is defer it to the next meeting as well, so we can actually spend a little bit more time, because I think this is quite an important topic. I think the groups concerned are significant in regards to the kaupapa of this committee and also the kaupapa of the district as well. So I don't want it to feel like I just didn't think we could have fit in enough time to give it the respect it's due at this moment. The good thing is it'll be part of a report back as well, because we'll be halfway through that 6 months, although it will be on the back of the Christmas period as well. Is that okay with you? Okay with that? Yep, fantastic. And guys, go. Joe, you haven't said anything. Did you want to comment at all?
No, not really, other than to just say, it has been a co-design process. We all councils moved to actually get this underway, because we've been under review for about, 3 years. And
Yes.
actually see it happening, and to develop that opportunity to strengthen those advisory groups, because council gets the best out of them if they're strong, and we get better results from our groups as well.
Yep. And just recognising that the structure is now in place for that work to be done effectively as well. With a very good team, by the way, in regards to delivery in this space. Excellent. Thank you very much. Thank you very much to council officers for giving that report. Much appreciated. Yeah. Okay, that's cool. Sorry, yeah, that's... Okay, what have we got next? Okay, we have the update on the health strategy. This is going to be a bit more of a streamlined report as well, coming from Victor and Gina. Come on down. I'm just deferring the whole thing. What I should have done is just got it to left lie on the table, but the report's going to come back at our next meeting, so we can put a little bit more time into it. That cool? Bit of swinging and dinging. Yes. Oh, sorry, we're live streaming. Okay, rightio, this is an update of the health strategy. No comment. Gina, please take it away.
Sure, and we'll do a nice speed run for you today. Really happy to take the paper as read. You can read some more detail on some of the feedback that we've had through the engagement process that we had earlier this year, and some of the engagements that we had with key stakeholders as well. To really just summarise, if I direct your attention to paragraph 17, you can see some of the things that we're looking at incorporating in from the feedback that we've received. So additional emphasis on some of the infrastructure and facilities that we do deliver in public health, and looking to work with particularly the population working group of the Kapiti Health Advisory Group on some other things we might be able to emphasise in population health. In the second focus area, building our understanding, aligning some of that discussion with the social needs analysis that we've got underway, and working with some of the iwi Māori partnership boards as well, who are progressing their own needs analysis processes for areas of our district, and emphasis on ensuring that advocacy is based on evidence need. And then the three areas that relate to access to services, and seeking to get better access to services for people in our community, really making sure that we are clear on what we mean when we're talking about council's role in that. So what does that look like, which is really facilitating, advocating, that kind of space. And as part of the next steps, we really want to make sure that to make sure that we're delivering on this, we want to make sure we're working in partnership with those stakeholders, particularly the stakeholders that do deliver services. So we are making sure that we take the time to engage really well with them. We've had some initial discussions with our iwi Māori partnership boards that relate to the two different areas of our district, Otaki and the remainder of Kapiti. And we want to have some more engagement with them and a collective engagement with the iwi Māori partnership boards, primary health organisations for both areas, local, what were DHB representatives, so local areas, but also the regional representatives of Te Whatuora. That's our key next step that we're looking to do in about February of next year. And then a wider health sector symposium, so a bit wider engagement with more providers in the district, making sure that we're working in a space where people understand what it is that we're doing, and what that looks like, and we can get a really collective picture of what the issues are for Kapiti. We can represent the local need and local views really well in engagement with the people who will be providing services. Otherwise,
Excellent.
finished here.
Excellent overview of this. And look, we've just had a presentation earlier in the meeting around the success of the approach that's being taken here with regards to the work that's being done for the polyclinic. So we're actually going gangbusters, in my opinion, with regards to things. Going along to the Kapiti Health Advisory Group meetings is quite fantastic, actually. And we went along to have a look at one of the mobile surgical trailers yesterday. But just want to emphasise again that OTAC is not out of this conversation by any stretch of the imagination. It's a big part of this conversation, but it's a different part of the conversation because, should we say, for want of a better way of putting it, the rules of engagement with regards to the Otaki situation, how it relates to Kapiti, is something that's a developing kaupapa, if you like, but in a positive way. And I think we're actually in a really good space at the moment with regards to engaging in that space and moving forward the conversations. We do have time for a couple of quick questions, if anyone does have one. But just bearing in mind that there will be constant updates and touch bases with the health approach, each meeting that we have as well. Kathy.
Thank you, Mr. Chair. It's not really a question, but I just wanted to comment and say thank you very much to Councillor and to Gina, because as we were going through the presentation, I thought we need to walk the talk, but we actually are walking the talk to ensure that something does happen.
We are.
So I just wanted to shout out a big thank you for all the work being done, and thank you, Gina, you're amazing. So thanks.
Aw. Here you go. I've got my emergency snack container. Have a feel free to grab a chocolate bar. There you go.
I'll definitely come back.
It was a birthday present from, I will say, the Raumati Community Board. There you go. But after saying that, you have to share it with Victor. Excellent. Thank you very much, Gina. Much appreciated, and we'll see you at our next meeting in February. Okie dokie. We are going to do confirmation of the minutes. Page 65. Just thank you to council officers for your time. Much appreciated. 65. Confirmation of minutes. I'll take that as read. Do I have a Nigel as a mover? I have a seconder? Yep. Any debate? No. Then all those in favour? Aye. That's moved. Thank you very much. We now need to move into public excluded. Can I have a mover for that, please? Nigel, happy to... No, that's why you don't like public excluded. Yep, Janet's public excluded, and if I could have a seconder for that as well, please, Rob. Yep, Rob, thank you very much. So if we can move to public excluded, and we just got, so if we can